Hi guys, welcome to our weekly Friday Facebook Live. I'm Dr. Jennifer Greer. I'm a board certified plastic surgeon, and today I'm going to be talking about permanent versus temporary facial fillers. Before we get started though, I want to let you guys know that I have a free 1-hour weight loss masterclass coming up on January 17th and January 19th. I've got 2 sessions, both in the evening. Some really great stuff, basically the techniques that helped me lose 45 pounds, and they were totally contrary to what I learned in medical school. So if you are frustrated and you feel like you can't lose weight, come join us. I'm going to give away a lot of really good information, stuff that you can put into place right away. You can register at jennifergreermd.com/masterclass, and we'll put that link in the comments for you. All right, so back to our discussion on temporary versus permanent fillers. Facial fillers add volume to the face. They're really commonly used around the mouth, in the smile lines, and over the cheeks. They can also be used in the temples, along the jawline, and even on the nose. And of course, you've seen lip filler to get plumper, like those bee-stung Angelina Jolie lips. So fillers come in 2 forms. There's temporary and there's permanent. Most of the fillers I use are temporary. This means when we inject them, your body gradually breaks them down over a period of about 6 to 12 months, depending on the filler. The only permanent filler I use in my practice is Sculptra. And Sculptra isn't technically a permanent filler because the filler itself breaks down, but it stimulates a collagen response, so your body builds its own collagen. The permanent fillers on the market include Artefill and Bellafill, and I don't use any of those in my practice, and I'm going to tell you why. Permanent fillers are permanent. They stick around forever. So if you don't like them, or you have a little lump or a bump, or it's visible, you can't do a darn thing about it. Now with Sculptra, it's building your own collagen. It's much more diffuse and very natural, and it's done gradually with multiple treatments 6 weeks apart. So Sculptra gives a very nice effect. But the permanent fillers on the market are really meant to replace the temporary fillers like Radiesse or Juvederm or Restylane. And the problem is, if you get it wrong or it doesn't look natural, then you're kind of hosed. I've had multiple patients come see me after getting permanent fillers, and they may be able to see a little line or a bump or something that just doesn't look right. And unfortunately, I don't have a lot I can offer them. The only way to remove permanent filler is to surgically excise it, and that's going to leave a scar. So we only do that if you actually have an infection or if it formed like a granuloma, which would feel like a lump. Otherwise, you're kind of stuck with it. So if you are thinking about permanent fillers, please do your research. Make sure you are seeing a board certified plastic surgeon, and they need to be certified by the American Board of Plastic Surgery. There are other boards out there, like the Board of Cosmetic Surgery, that don't have the same rigorous standards. So that's what you want to look for. If you have questions about fillers, leave them in the comments. I promise to get to them. And then of course, if you're interested in fillers, we have walk-in hours every Friday from noon to 3. We just ask that you call and check in. Sometimes I'm pulled away to an emergency. Our number is 440-974-8577. And don't forget to register for my free 1-hour weight loss seminar. It's totally online, so you can curl up in your jammies with your cup of tea and just learn some great stuff about weight loss. And that's at jennifergreermd.com/masterclass. I hope to see you there.